Hi everybody, this is Dr. Sham. I'm a rheumatologist. I practice from Chennai. So today's video we will see what is called as spondyloarthritis. See, in rheumatoid arthritis videos, I already told anybody. Okay, let us take any pain in your body, any bone or joint pain. When you get up in the morning and when you have stiffness, then it is going to be an inflammatory pain. So back pain is going to be a very common symptom. Most of us will have back pain. Once you do some work, you travel, you ride a bike, you do some heavy work throughout the day. Once you go and rest in the night, after initial some time, it eases out. But if you're going to have pain in the night time, particularly in the early morning, if it going to wake you up from the sleep, or when you're getting up from the sleep, you have severe pain, stiffness, you are not able to move around, then you have to think like an inflammatory problem called spondyloarthritis. See, it's like an umbrella term. You have so many things under it. One is common disease is called as an ankylosing spondylitis. Then you have psoriatic arthritis. Then there is something called inflammatory bowel disease. Those people also can have spondyloarthritis like symptoms. Or sometimes post-infection like a urinary infection or a bowel infection, you can reactive arthritis. So anybody who gets up with a low back pain or morning stiffness, or particularly in the early morning, it wakes you up from the sleep, you have a buttock pain, particularly alternating buttock pain, always think of spondyloarthritis. So in spondyloarthritis, one of the common disease, what we call is ankylosing spondylitis. As I told, the earliest symptom is that morning stiffness or low back pain. Sometimes it can happen in the neck. For example, females, they will have more of neck involvement. But again, it will be more common in the early morning and they get up with the morning stiffness. Usually, it is a disease of young males. So for every 3 males, 1 female might be affected. Usually, it starts in the early 20s. Sometimes it can be juvenile in onset, even before 16 years of age. Those people can have an aggressive disease. We have to be very careful in managing those people. So in ankylosing spondylitis, somebody tells that they have these symptoms, then you have to go to your physician, and usually they will do a blood investigation and maybe an imaging. These days, particularly with the advent of MRI, things have changed, because those days with X-ray, only once the damage is done, we will be able to see the changes. So at least the disease should have been there for a period of 2 years for you to appreciate it on the X-ray. Whereas now it is not like that. With an MRI, even if it is a couple of weeks pain also, you will be able to appreciate it in the MRI. So identifying this is very, very important, because unless if you're going to identify early, many times patients go in for deformities, which later it becomes very difficult to correct it. So in ankylosing spondylitis or spondyloarthritis, remember, anybody who gets up in the morning with a low back pain, stiffness, or in the early morning sleep gets disturbed due to that, you think of that. These patients can also sometimes present with a knee pain or ankle pain. So usually it's leg joints which are involved, knee or ankle joint pain and swelling. Also, they can have associated things like a psoriasis or a recurrent diarrhea like inflammatory bowel disease or an eye inflammation. These are some of the associated things. Or sometimes they can have something like what we call enthesitis. They can have a heel pain, tennis elbow. These things also can be associated. But low back pain in the morning, think of spondyloarthritis. If it is going to be a pain in the day which eases out with rest, it is a normal pain which most of us have it. So this is about spondyloarthritis. Thank you.